So behind me, you can see the exotics ward, which is where
we would house any of the exotic animal patients that we'd have: birds, lizards, gerbils, things along those lines.
that's a gerbils? They're exotic?
Hamsters? I mean, we call them exotic, yeah.
And where are we now? What is this? What is this room?
This suite is cardiology. This is actually opening this month, and we'll start seeing cardiology cases with our cardiologist, Dr. Kochi.
Pretty techy in here.
Yeah, a lot of really nice new equipment we have in this brand new hospital. So
Yes.
This is a unit for cardiac ultrasound or echocardiogram.
Check it out. Look at that. It's pretty. This place is really advanced. I mean, you guys probably have the latest and greatest of everything.
We do. We're really, really lucky to have a brand new, nice facility with a lot of nice equipment.
Giddy up. So we're in the X-ray room.
Part of diagnostic imaging.
So we're gonna do a little spin, and so you can see what's going on here. Look at that.
This is a fluoroscopy unit, so we can do live view X-ray with this machine.
That's pretty cool.
Yeah.
How big of an animal can you put on this thing?
As big as we can get through the door. No mules in this one.
One of these I'm gonna lay down there, see what happens. So this is another high-tech room, you said.
This is our 3 Tesla MRI. This is in the midst of being installed, but another 3D imaging modality that we can offer here at the teaching hospital.
That is a pretty cool. So what exactly will that do?
This is for imaging of structures that, let's say something comes in with an issue with a disc in its back. This does very high resolution, 3-dimensional imaging.
Wow.
Brains, any kind of scan that we could do with this machine.
Probably inexpensive.
It was.
So apparently this is where the animals will come to get anesthesia, right?
Yeah, this is anesthesia induction. Before we take animals into the surgery suites, this is where they would come to be placed under anesthesia.
Pretty cool. So this is the room you said where all things eyes happen.
This is ophthalmology.
And we have who?
Hi, hello. Hi, I'm Marvin Cousteau. I'm one of the ophthalmologists.
So what are you doing in here?
This is Optoland. This is Eyeball Land. So right now we are open. We're receiving patients, tending to patients. We have several today between myself and
Come
Dr.
this way.
Lutz. Oh, sorry.
No, you're
I'm
good.
not good at being on camera.
No, you're good. We just want to show them what you're doing here.
Yeah, so this is Optoland. We're pretty mobile here. Where one of our exam carts is currently in exam rooms because we're seeing patients.
Right.
But we're pretty mobile. Where we have our slit lamp, all of our equipment kind of lives on 2 carts. We can roll them around. It's nice because we can kind of get to exam rooms that way, but also if there was a patient in the ICU that couldn't be moved or anything like that, that we can kind of come to them, which is really nice. So we can kind of be collaborative in that way.
So what's the coolest thing you've done so far?
So the coolest thing I've ever done in ophthalmology for me is cataract surgery in general. So right now we have a cataract, 1 or 2 cataract patients coming up in the month of January. So really excited to kind of see them and hopefully see their candidacy. But cataract surgery is my jam. So I love lens work. I love cataract surgery. I love the moment where they wake up and can see because they go to sleep blind and they wake up visual. So,
right. He knows where I'm about to go. That's not a sentence you hear every day, right? Cataract surgery is my jam.
I wish nobody ever needed it. I say that for every surgery. I wish nobody needed surgery ever, but the fact that we can offer it is really special.
That's amazing.
So.
This place is absolutely amazing.
Yeah.
Well, thanks for talking to us.
Of course, that was great. It was great to meet everybody. Hi, I don't even know. Am I on record? Am I online? I don't know.
Hey, how are you?
Good, how are you?
So where are we right now?
We are now in the veterinary pharmacy at the teaching hospital.
And this is where all the drugs are, right?
Medication.
I didn't say drugs are. I said
Medication.
where all the drugs are, okay? Medications. It's probably a better word. And this is
Our pharmacist. Want to say hi?
Yes, hi, how are you guys?
so do you like being a pharmacist here?
I love my job.
I love my job. It's a great thing to say when you're standing next to the boss. But really, this is kind of cool, right? This building's amazing.
Yes, it is a piece of art and we helping all the animals to feel better. There's no better job.
Wow.
And we're happy to have you.
All right, so where are we? So we're in the hallway of a couple of things.
This is the 2nd floor. We're now into our academic spaces here at the vet school.
There's a teaching laboratory behind
This is
us.
our dry lab behind us, and in front of us are 3 of our classrooms that take half of our class cohort.
And right here too, right?
Yep, right behind us.
So right behind us, we got a classroom. I'm making this poor guy walk backwards all the time
I'm
so we
getting
can,
better at this thing.
so we can see everything, all right? It's pretty amazing. So it's cool though. And then again, if we take a look down the hallway, we've got a ton of Dr. George's art waiting to go up.
This is for you, Jim. You got to watch this
This
clip.
is for you, Jim.
Thanks again.
So we are in the big lecture hall.
Yeah, this space will take 3 full class cohorts of the 4. We can put everyone in here all at once.
How many people?
This is for 96 max each class, so we can put 3 cohorts of 96 in this room.
So this is where I'll be giving my lectures
Yeah, come on over.
about God knows what. This is actually pretty impressive because most of the schools I've been to don't have them set up like this.
These are all modular spaces. We want to not just have fixed seating in these rooms because
Right.
we use them for different purposes. And really, the students in our program, we really heavily emphasize clinical skills. So they're not in the lecture hall all day. They'll come in here as a big group and then split out into other activities.
Oh, and this room splits into 3, it
It
looks like.
does. It splits into 3.
That's pretty cool. We'll have to have an event here.
Let's do it.
Let's do it. So we're standing here at this plaque, and also, let's talk about who this is.
Yeah, this is a wall of all of the folks who've donated to the school, but up on the top there is Jerry Shreiber, the former CEO, founder of J&J Snack Foods.
Oh yeah.
And he is our naming donor here at the Shreiber School of Veterinary Medicine. We're very, very happy to have him and his wife, Melanie,
Very
to
cool.
support our program.
And you have him behind us in this picture here.
He is.
That's pretty cool, right?
It is.
And he's got 3 dogs in there too. Is that a blue
He has
heeler?
a collection of dogs. It looks like that. Yeah, that is a heeler over there. But he's really a German Shepherd guy. He's got a lot of shepherds in his
Got a lot of shepherds. The dogs, if you don't know about blue heelers, they're actually blue, right?
Yeah,
And
bluish.
people have said it to me, and I'm like, you have to see one in person to actually see the blue hue of of the dog. It's pretty cool. But this is very nice. That you know, yeah, I guess it's a big thanks to this gentleman, right?
Yeah, absolutely. Yep.
For-
and a lot of other wonderful donors who support our students.
And
here.
all the other donors up on the wall, right?
Yep.
You know, big thanks.
We're. Oh,
Go ahead.
I'll let you introduce us. I'm trying to do your job now. We're doing this so long.
Take over.
This is in another academic space. This is our wet lab. So we teach things like microbiology and parasitology.
Right.
All the labs that might be a little bit messy, they occur in this
You
space.
see the horse heads in the window?
We're getting there next.
Okay, that's next.
That's next.
Let's do a little roundabout here because behind us is kind of cool. What is all that?
Those are all microscopes.
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 So we can see what's going on up close and personal. So what are we looking for here?
In
like,
here?
yeah, I mean, what
This
happens?
is be training in things like parasitology, where we're looking for parasites in samples, or microbiology, where we're looking
Disease.
at bacteria and fungi, things along those lines.
Yuck. That's what I have to say about this. But it's nice that they're doing it, right? Take
Gotta
care
know.
of your animals, our animals. Where are we?
Clinical skills teaching lab.
And what did you say? One of the nice things is what?
This is where we have models to train students before they get to live animals. So,
See that
yeah,
cow?
it's a Holstein.
It's a who?
It's a Holstein. It's a breed. I have to
That-
teach you some.
oh, is
cow
that
breeds
right?
while
I was
we're
gonna say, I just thought it was a cow.
So
I mean-
we have that cow model is actually for basically for pregnancy and delivering babies that are maybe not positioned correctly.
Oh, really?
So we can put a cath inside there and teach students how to manipulate and deliver a baby that might be stuck.
How strong is that thing?
Well, that's fiberglass. That one's not that strong.
Yeah, I know.
The real ones are pretty strong.
Can I sit on it? No, I'm kidding.
I don't think we're gonna
Yeah.
do this. And then we have a horse as well over here.
I feel like I'm on Home Improvement. I don't think so, Tim. The horse.
That's
and
a
then
horse.
and then we've got the horses' heads behind us.
We do. A lot
Why
of
do you
horse
have
heads.
horses' heads again?
Those are training models for drawing jugular blood samples or putting what we call nasogastric tubes or stomach tubes. So we
Wow.
can teach these skills on a model before the student tries it on a real animal.
Thank God.
Yeah, absolutely. And then these are reproductive models where we can diagnose pregnancy and stuff as well. Lots of training models in here. All the cats and dogs are hidden in the room back there, but
Right?
large animals are out today.
I'm still a big fan of the cow, though. Does the cow have a name?
I don't know. I mean, Betsy's a good cow name. Let's call her that.
Betsy, it was nice to meet you, buddy. Next time, I'm gonna sit up there and he's gonna take my picture. It's gonna be a fun time.
And it's spleen, and there's kidneys here, so we can teach students to palpate, rectal palpation, like we do in the clinical setting, to feel where these organs are inside these animals. And then we can misposition them and cause them to what we call colic, when they have abdominal pain because something is wrong in their abdomen. We can change this around to simulate different types of colic to train students on a model versus training them on live animals.
Same with the cow, right?
Same with the cow, except that model's specifically for learning to deliver calves.
Okay.
Different use, but same sort of theory.
And that's Betsy. Does this horse have a name?
You can name them. How about that? We'll let you name the horse.
Trigger. We're
All right,
good.
Trigger and Betsy. Here we
Trigger
go.
and Betsy.
Yeah.
Fun stuff. We're in the secret room.
This is our surgery viewing gallery. Right now the glass is frosted, but students can sit up here and watch surgical procedures down below.
Yeah.
And then we have TVs in here as well, so we can send information from the lights we have in surgery cameras or the feed from a laparoscope. We can send that up here so they feel like they're right in the space where the surgery's taking place.
That's pretty cool though. I mean, you can, with a flick of a switch,
Hit a button, glass goes clear.
and there's a whole operating room down there.
Yeah, this is 2 of the 3 surgery suites, and then we have a dental suite you can't see, but 2 of the 3 ORs are part of the viewing gallery.
That's a great way for people to learn, I'm sure.
Yeah, we want them to feel like they see the flow in this area and feel comfortable with it while they're early in the program, so when they're in their clinical year, they're more comfortable in that space.
Cool stuff. Very cool stuff. So we're in clinical pathology. I have no idea what they do here, but Matt's going to tell us.
Clinical pathology is our point of care testing lab, so we do things like blood counts, blood chemistry, thyroid testing, cytologies in this space.
Very cool, right? And so we can see the microscopes that we were kind of scoping out, no pun intended, a little earlier, right?
Yeah, this is a teaching microscope. This has multiple heads, so a pathologist can look at a slide and show a bunch of students around them exactly what they're looking at too.
And what do these young ladies do?
Do you want to tell us about your jobs, ladies?
What do you do? What would you say it is you do here?
We run the blood work through the analyzers, and we look at your blood smears or your
Yeah.
pet's blood smears under the microscope.
And you fix them up? You figure out what's wrong so you can
Figure out
fix them?
what's wrong with it.
And what do you do here?
I am Becky's counterpart. We do the exact same thing.
What's your name?
I'm Eva.
Eva. So do you like it?
Love it so far.
You love it so far? How long have you been here? It's only been open what?
The lab itself isn't open yet, but we both started in September.
Right?
So
So do you
this was
like
an
working
empty
here?
room when we got here, so it's getting better.
It's getting better, getting more active.
Yeah.
Can't wait to see more. Is it patients? Is that the right word?
Yeah.
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 Very
Still
nice.
Patients, even though they're furry. There's-
Furry patients. That's what I should be saying. I like it. Very nice. Well, thanks for talking to us. All right, so we've done everything here that we can think of, at least once.
We've covered a lot of ground.
We've covered a lot of ground. Thanks for being on.
Thank you.
Thanks for being part of Walking and Talking with Tim. I have a feeling this is going to be a 2-parter. I'm not sure yet, but everybody out there, keep on walking, keep on moving. Follow me on Instagram, Facebook, LinkedIn, YouTube, all that fun stuff. And we will see you next time on Walking and Talking with Tim. Peace, y'all.